even during demonstration or wherever when there are crowds, and especially amplifying events, we should keep our distance, we should wear masks, even if we may have a mild case. We should always remember that there may be another person who could be young or old who may have severe condition and could even die.
Marcia Ori is a professor of public health at the Texas A&M School of Public Health and joins us now from College Station. Marcia, good to have you with us. Well, let's start with the US. We've seen record daily increases in areas, particularly where universities have reopened with face-to-face teaching. That must be of huge concern.
I think it is a concern because you have more students coming back to campus. Some are coming from other areas. So it is a concern, and it may generate the next set of spiked cases. We've already seen that in the Midwest, and we're seeing that in the Southeast also. So it is a concern at the college level. But that's just one set of students. We also have students in kindergarten to 12th going back to schools.
Can I also ask you about conflicting health advice that's given to people, particularly depending on what country you're in? For example, face masks. Wear face masks in the street. No, don't wear face masks in the street. Wear them inside. No, don't wear them in classes. Wear them in corridors. I mean, there just seems to be so many different bits of guidance. Why isn't there uniform guidance over something like this that can remain the same regardless of where you are?
I think the public health guidance is consistent. If you look at the Centers for Disease Control, it is wear your mask, be socially distant, it is wash your hands. So there are a set of guidelines that the head of, and we just heard the Director General, the same guidelines that international are the same guidelines that are being recommended by our CDC federal government. And states are recommending those guidelines. What differs, I think, is how they're being enforced across states.
But not just across states. I mean, there are different guidelines in different countries. And perhaps that leads to confusion in the minds of the public.
Exactly. The public, to get people to follow a public health message, it has to be consistent. So I'm here to say exactly the same thing that the Director General said. Best public health practices are all the things that we've been saying for the last 6 months plus. That is face coverings, social distancing, and hygiene, like washing hands. It should be consistent. It's unfortunate that it's not consistent because you're right. When people hear things that are not consistent, they tend to do what they believe because they think, well, nobody's telling me what to do. I'll just do what I feel comfortable doing. And that's the wrong message. There needs to be a very consistent message.
And we've also seen several countries having anti-COVID restriction protests, people who disagree with lockdown. And part of these protests are, there's a section of the public, we have them here in the UK, who say coronavirus is a hoax, or the effects of COVID-19 are being over-exaggerated. As a public health expert, is this a common response?
It's a worrying response. It's absolutely worrying. I'm not surprised because always there are different opinions about any situation, but this is a situation that's a matter of life and death. So I would hope that people would understand, but what's happened with COVID, it's become politicized. It's no longer just a public health issue, but it's also a political issue where people say, it's my right, it's my individual right. I think the only way that we're going to beat the COVID outbreak is collective action, and that means everybody following those appropriate public health rulings. So we know, for example, in the US, there have been large motorcycle rallies where there are hundreds of thousands of people without masks. And unfortunately, we see afterwards there are super spreader events that more people are getting infected. So I think if people can see the consequences of their action, perhaps they will act differently, because I think everybody wants the outbreak, the COVID, to go away. It's been bad internationally, it's bad for health, it's bad for economy. So it's something we all need to do to have a mitigation under control.
Marcia, thank you very much indeed for that. Good to speak with you there. Marcia Ori there.